So we start history taking for this time and the next time. Again, we will finish, inshallah, for a student who will attend for September 2024. After that, I think from November, we can arrange another session for the people who will be apply for the next exam, next year exam. Okay, so we start first by history taking, and our first history taking is acute abdominal pain. Anyone can start to have about 6 scenarios, or many scenarios, so each one can share. So who is the first volunteer?
Can start, Prof.
Okay, so hi, Mariam. So it is 55 years old male with epigastric pain radiated to back after attending his daughter's wedding, and he drank a lot, about 9 cups of alcohol, and he usually drink but small amount on weekend. He's married, have 2 children, live in his wife and children. So what we need from you, just take focus history or history, and we just ask you some question maybe at the end. Okay?
All right.
Can you start?
So before I start, do I ask you as being the patient, or
Yeah, I am the patient. Yes.
Okay.
Okay.
Hello. Hi. Good afternoon. I'm Dr.
Yes.
Mariam.
Again, Mariam, don't need to say hi in English culture. Hi is not a good word. Just to say good afternoon, good morning.
All right.
Any word. Okay.
Okay.
You can start. All right. Okay. What else?
Good evening, Mr.
Yeah.
I'm Dr. Mariam. I will be taking a brief history of you before we get started on your medication.
Okay. Yes, can.
How are you feeling right now?
I am okay. My name is Limp, and I am 55 years old.
Okay. What brings you to the hospital today?
I have severe epigastric pain radiated to my back. It is occurred yesterday when I was in my daughter's wedding.
Okay. How is the pain right now?
No, you missed something important now.
Right now, do you have a lot of pain?
No.
No?
If the patient, he say, is after attend his daughter wedding, so what's supposed to tell him?
Oh, congratulations on your daughter's wedding.
All right. So it is important to have an exam, to have some empathy before take a history. Okay. No problem. Thank you. So what else you need to ask?
How's your pain? Are you able
it is colicky in nature.
Are you able to talk to me with the pain, or
yes,
should
can.
I give you some medication before we continue?
No, I take the medication, no problem.
All right.
Okay.
So you said your pain started yesterday from epigastric region, right?
Yes.
What kind of pain? How was the pain?
Was it colicky pain?
Colicky pain. And then the pain was going back to your...
Radiated to my back.
Okay. Yes. Before the pain started, did you do something different than you used to do?
No, I just drink a lot of alcohol because it is my daughter's wedding.
Okay.
This is the only difference.
Do you usually drink a lot of alcohol?
No, I can drink, but this time I drink more.
Okay. Did you have any nausea, vomiting?
No, you need to analyze the pain.
Okay. Onset character.
Okay.
Radiation. Okay. So did you have any nausea, vomiting?
No, you analyze the pain first, like what increase the pain, what decrease the pain, what is the pain score, all this. After that, you ask about associating symptoms like nausea, vomiting.
Okay, so from a score of 1 to 10, how...
No, ask Mariam slowly. Yeah, this type of pain is colicky, increased by drinking alcohol. So what decrease it? It is decreased by rest or something like that.
So you said it started like something different you did is alcohol intake. But do you notice anything that you do which relieves the pain?
Yeah, I just rest and if I take some medication.
Okay. Do you remember the name of the medication?
No, the doctor gave it to me.
Okay. So is there any fever before you started?
You ask about nausea, vomiting before fever. I have some nausea, no vomiting, no fever.
No fever. Did you notice any change in color of your eyes or urine with this?
No.
No. Have you had this kind of pain before?
No.
Okay. So with the vomit, did you notice any blood or blood tint, coffee colored anything in the
You mean
vomit?
in vomiting or what?
In the vomiters,
No.
yes, in the
I
vomit.
no vomit. I have no vomiting. I have nausea
Oh,
only.
just nausea, right?
Yes.
Sorry. So during this, since yesterday, are you able to take your meals regularly?
Uh,
And
unable to take
do
what?
you feel like eating, or do you feel like you don't want to eat at
No,
all?
no, no. I can eat. No problem.
Okay. How about your bowel movements?
It is
Usually, how?
okay.
Okay. All right. Do you have any problems with the chest? Does the pain go to your chest? You have palpitation, anything like that?
What you mean by palpitation?
Do you feel like your heart is beating in your chest? You
I don't
feel
feel my heart beating.
you feel your heart beating very fast in your chest, like when you after you run, you have that kind of feeling. Do you have that feeling?
Okay.
All right. Also, uh, do so. And persistent. Do you take any other medication for any other diseases?
Like what?
Long term, like your diabetes, hypertension, thyroid medication, anything like?
Diabetes, hypertension. This no,
No. Okay. How about cholesterol medications?
no, no,
Have you
no,
been
not
have you been have you been admitted in hospital before?
no,
Have you had any medical surgical procedures done on you before?
no.
No. Okay. How about your family? Do you have like family members with any first meaning your kids and
No, but I think my grandfather died from car accident.
oh okay. So are you allergic to any food or
Uh, Allergic to seafood.
allergic to seafood? Any medicine you remember having any allergy to?
No.
No. All right. So how about your house? You mentioned that you drank a lot of alcohol. Are
Yes.
you a habitual drinker? Do you drink a lot
Yeah,
usually?
I drink every week one of alcoholic can of beer every weekend.
Okay. How about smoking? Do you also smoke?
Yeah, I smoke yes 10 cigarettes per day for the last 20 or 30 years.
Okay. All right. All right. Then I will move on to your examinations.
Okay, all right, thank you. So you need
Thank
to
you.
summarize, for example,
Okay.
okay, but what you miss in your presentation, you missed to ask about loss of weight and the loss of appetite, which is
Okay.
important.
Okay.
When I tell you my grandfather died from something, so you need to say sorry for that. So you must have some
Okay.
sort of empathy.
All right.
All right. After that, this is supposed to be 6 minutes. After
Okay.
that, we ask you some question. So
Okay.
based in the history, what's your differential diagnosis?
I think acute pancreatitis
Acute pancreatitis. So what
and
else it can be?
peptic ulcer disease can be,
Can
and
be okay.
cholecystitis or biliary colic.
Okay. So for this patient in particular,
Mm.
what is the investigation can be confirmed that it is acute pancreatitis?
I will go with serum lipase, MLS lipase specifically.
Okay. So can be both. Okay.
Yes.
All right. So if we make amylase and it is elevated, what other tests you need to do?
So I will run a whole blood investigation, WBC, full blood count, urea electrolyte. I will check his LFTs. Before that, I will also do an ABG actually and blood sugar to get started with.
Okay. Any radiological investigation you
Yes,
need
I
to
will
do?
do a chest X-ray to see if there's any pleural effusion with the ongoing pancreatitis because my main diagnosis is provisional. I'm working
With
on
you, you
is
can do
pancreatitis.
chest X-ray to exclude
Yes,
perforated viscous if it is one or
yes,
differential diagnosis to see air under the thread.
yes.
What
And
else you do?
I will do a CT. I will go for a CT
Okay,
scan.
abdominal CT or ultrasound CT.
Yes,
What is the
abdominal.
usually etiology of acute pancreatitis in this patient?
So for this patient, I think it's alcohol consumption.
What is
But
other cause of acute pancreatitis in other patients?
biliary gallstones.
Gallstone. Okay. All right. Can you see this picture?
Yes, can see.
So this is have two arrows, the dark one and white one. What this area contain?
That is the pancreas. It's a bit bulky with peripancreatic fat stranding, I can see. And
You see my arrow or not?
yes,
What is
yes,
this area?
that is is it the venous phase or arterial phase?
No, it is calcification, just
Oh,
calcification.
okay, pancreatic calcification.
All right.
All right.
So what is the easy way to know the prognosis for pancreas?
So pancreatitis or pancreatic CA?
Pancreatitis.
Pancreatitis, so there will be like
Severity of the case. So what is the scoring you use?
Glasgow scoring.
Okay, so Glasgow is easy to remember. Just write
Yes.
PANCREAS, and each one have indication like B for PO2, A for
Yes.
age, N for neutrophil, calcium. What about calcium? Is decrease or increase?
Decreased in
Decrease. Okay. Renal function
pancreatitis,
test. Liver enzyme not include amylase and lipase, acidosis and
acidosis,
albumin, and the blood sugar.
hypervolemia, and blood sugar.
Okay, how to treat this patient?
So usually acute pancreatitis come with severe pain, so I will give analgesics, and the main focus for me would be to hydrate, keep the patient nothing by mouth, and gastric decompression with an NG tube, or if there's persistent vomiting also, I will do NG tube. Then depending on the severity index, I will assign the patient either HDU or ICU or ward management.
Okay.
Then hydration status with CVP. Since I'll be giving a lot of fluid, I don't want him to go into fluid overload also.
All right. Okay. Thank you. I just put this slide just to remind you, it is not in the hospital policy or Malaysian culture or other culture. I don't know the others. We don't ask the patient what we called it ICD, which is an idea, concern, expectation. It is not in the classic way of history taken in British culture. Maybe in other culture, maybe in Middle East country, but not in our Far East or UK culture. What you expected from us to do and all this, we don't have this. Thank you in Malay. Okay, so it is okay. Good presentation, Dr. Mariam. I have another question, another scenario for the next one. It just you are good, but don't forget to ask about loss of weight, loss of appetite,
Yes.
and of course, if we put a scenario, the patient attend the wedding or something, you need to have empathy. If the patient saying which one died, so you need to also to just have some sympathy of the patient. Thank you. All right, shukriya in Maldives language. Okay, thank you. One others, we have a case of another abdominal pain because abdominal scenario is very, very, very complicated scenario. So we have another abdominal pain, but different scenario. Anyone? We have about fifth or sixth in the history taken for today. We have about 13 scenarios, so each one can be helped. Dr. Iman, if you are available, you can start. Anyone?
I can do if anyone is not.
Okay, so we start with you, Mariam, again. So I am 45 years old woman. I am the actor, complain of yellow discoloration of sclera on her eye and abdominal pain. Take a history and the examiner ask you some question. Okay. So can you start?
Yes. Hello, good evening.
Okay, good evening.
Mariam.
Yes, I am Siti Nooreni. I am 45 years old.
Okay. What brings you to the hospital today? Can you tell me?
Yeah, I have just yesterday I invited for dinner, and when I eat, I have severe abdominal pain.
Okay. You said this started yesterday?
Yes, yesterday evening.
Can you tell me where in the abdomen your pain started?
It is in the right upper part of my abdomen.
Okay. Does the pain go anywhere else?
It is radiated to my right shoulder.
Okay. How do you feel the pain? Is it continuous or is it come and goes like this?
It is colicky, so it come and goes. So it is intermittent pain.
Okay. And then you said it goes to your back also, is it?
No, no, it is my right shoulder.
Right shoulder only.
Yes.
All right. Do you have any nausea, vomiting, anything like that?
No, still you need to analyze the pain. You know, pain
Okay.
is have a lot of number. So the
Mhm.
site of pain is a right
Okay,
radiated to the
radiation
right shoulder,
corrections
colicky in
quality.
nature.
Then, okay, what makes you pain more? Like, what do you notice anything that you do which causes more pain?
I notice because I eat some fatty food. So when I eat fatty food, the pain increase.
How about is there anything that makes it better?
If I stop eating or eat non-fatty food.
Okay. Then, do you have any fever with the pain?
No, no, just relax again, Mariam. Better score. So out of zero, for out of
Okay,
10 is
pain
zero
score.
is no pain, and the 10
Okay,
is 10.
how much would you say your pain is
It
from
is
1 to 10?
when it started, it is 7, now becomes 3.
Okay. Uh, then I will ask about fever. Did you
Okay.
have any
Yes,
fever?
I have a fever. The nurse measured the temperature. It is about 38.5.
Okay, I noticed that you said about color change. Did you notice this before the
No,
pain?
actually, my husband noticed that my eye is become, my white color of the eye become yellow.
Okay, how about when you pass urine? Do you notice the color change at all?
Yes, it is look like tea color or dark color.
Okay, how about when you pass stool? Is there any change in?
I don't notice, but the doctor asked me to notice, so I will notice later.
Okay, if you don't notice, is it difficult to flush your
No,
after?
no, no, no.
No, didn't notice. Okay. Do you have any, did you notice any weight loss in the past 1 to 2 months? Anything
No,
like
no
that?
loss of weight.
Okay. How about itching? Do you feel like your body itches?
Yes, sometimes I have itching, yes.
Okay. All right. Can I'll move on to your,
You need to ask about nausea, vomiting. I have
yes.
nausea, no vomiting.
Yeah, okay.
After that,
Then, do you
other
have
system, you can ask about
history?
other system. Okay.
Yes. Okay. How's your sleep and
No, no, sleep is not important. You can start, if you ask about other system, you can start by shorting of breath. You can start by
okay,
heartbeat. You can start to
okay,
ask
okay,
about any diarrhea, constipation, and
okay,
after
okay,
something like that. Okay, I don't
okay,
have any shorting of breath, no
okay,
increased heart rate, no urine difficulty. After that,
okay.
what you need to ask in history?
Then past history and do you have any diseases where you take regular medications?
No, no,
And have you had any surgery done before?
no surgery.
Have you done any scans before for similar pain?
What you mean by scan? You
Any
mean
ultrasound, abdomen
no,
before
no,
similar kind
no,
of pain?
no.
No. Have you taken any medications
For what? Like
for,
what?
for this kind of pain before?
No, this is the first time I have the pain.
Okay. Then, how about your family? Do you have any family member who's had any issues with?
No, but my grandmother died from car accident.
I'm really sorry to hear that.
Okay, thank you.
Uh, okay, so I will move on to examination.
No, no, no. Just if you have allergy. You ask about
Ah,
allergy.
okay. Do you have any allergies?
No allergy to medication or seafood. You
Okay.
don't ask about social history.
Okay.
Okay, so it is important, Mariam, when you take a history, because some concentrate of history present illness, but if you miss
Okay.
social history, family
Okay.
history, allergy, past medication or admission to the
Okay.
hospital or other system, you can find 5 mark out of 20
But
is
when
done.
they ask for a focused history, am I supposed to
No,
go?
no, it's a focus
Okay.
history, including other part of history.
Oh, okay. All right.
Okay,
Okay. Okay.
it is like you can ask. History is a history
Okay.
because we
Okay.
have this problem many time in MRCS. If you take a history, you need to take a complete history,
All right.
but don't need in much detail. But you just ask about other system. I ask about shorting of breath,
Okay.
palpitation, all this.
All right.
Okay, so
All right.
what is your diagnosis?
So I think this is cholangitis.
Yeah,
Okay.
why? Yes, it is acute cholangitis. So why it is cholangitis,
So
not acute cholecystitis?
she
Why?
has She has the three criteria for cholangitis
What
actually.
this criteria we called it?
Fever, pain, and the jaundice.
So what this criteria called?
This is Charcot's trial.
Charcot trial. So what is the investigation you need to do for this patient?
So I would actually do the routine blood examinations and everything, followed by
Looking for what? Full blood count, looking for what?
full blood count to see for elevated WBCs and
Okay, so for
neutropenia.
liver function test, you're looking for what?
I will see for any obstructive pathology features in
Like
liver
what?
function, like
Like
alkaline phosphatase elevation.
What is more specific in liver function to see it is obstructive jaundice?
ALP with GGT.
No, ALP can also increase in others, but what is more specific to
Gamma glutamate.
No, also.
Bilirubin. Sorry.
Yes, bilirubin is more
Bilirubin.
diagnostic to which
Yes.
type of bilirubin?
Direct bilirubin.
Okay, so direct bilirubin can be with obstructive jaundice,
Yes.
indirect with hemolytic jaundice. Of
Hemolytic.
course, ALK and other liver enzymes can be high,
Yes.
but alkaline phosphatase may be high with obstructive jaundice, but maybe not specific. What other investigation? I show you first the ultrasound of the gallbladder. What you looking in the ultrasound?
So I will see for in gallbladder, I will see for thickening of the GB wall, then contracted or distended gallbladder, any pericholecystic collection, any stones or any.
So how to know this is a stone? This is what you see in picture.
So
Is a stone
posterior
or polyp?
It's a stone because there's a posterior acoustic shadow.
Okay, so you have acoustic shadow.
Yes.
All right. In patient of jaundice, what other investigation you need to do?
So I will do an ERCP for the
What
patient.
does ERCP mean?
Endoscopic retrograde cholangiopancreatography.
Okay, I show you the picture of ERCP, and this is what is this structure? Longitudinal structure.
Common bile duct.
And dilated. So what is this
Yes.
nearby structure and calcified? What is this?
It's a stone.
It is actually the gallbladder itself and
Okay.
calcified.
Gallbladder.
What we called it Barsolin gallbladder,
porcelain.
and we decided to remove it. So
All
why we remove this Barsolin gallbladder?
Porcelain gallbladder has predominancy for cancer GB.
GB mean gallbladder.
Gallbladder.
Okay, don't say abbreviation, not common use.
All right.
All right.
Gallbladder.
Okay. So in physical examination, what is the test you need to do in this patient to confirm acute cholecystitis?
I will do a Murphy sign on the patient.
What is Murphy sign?
Murphy sign is palpation of costal margin, palpation at the level of 9 costal cartilage, at the line of midclavicular line, where adjacent area. I will palpate with my thumb, ask the patient to hold the breath and release. During this time, due to the movement of the diaphragm, the distended gallbladder hits your finger. During that, the patient will be wincing in pain. If patient winces, then Murphy sign is positive.
Okay, it's not necessary to be distended. Can be enlarged or tender or something like that.
Okay.
All right. Okay. So I just continue with you because in the acute abdomen we have three scenarios. The first scenario is acute pancreatitis. The second scenario is acute cholecystitis or acute cholecystitis or acute cholangitis. Again, in acute cholangitis, you have jaundice. In acute cholecystitis, you don't have jaundice. The third scenario can come. We finish with Mariam. After that, we'll show you the other scenarios. I am 35 years old woman complaining of abdominal pain and bloody diarrhea.
Okay.
If we, again, in the Royal College, if we don't mention nationality, so it means that it is British woman.
Okay.
Okay. Apart from what you see in exam, because it is difficult to have a British woman in Malaysia or other country. So can you start to ask me about this abdominal pain again and the bloody diarrhea?
Okay. Good afternoon, ma'am.
Yeah.
I'm Hamza. Can I confirm your name and age?
Yeah, I am Miss Margarita. I'm 35 years old.
Can you tell me what brings you to the hospital?
Yeah, I have generalized abdominal pain and bloody diarrhea.
How long has it been?
It is just 1 week.
1 week back.
Yeah, but I used for that because it has happened many times for me.
Okay, so generalized abdominal pain. How is the pain?
It is colic in nature.
Okay, how severe is it?
It is sometimes severe, sometimes mild, but this time is somewhat severe.
Okay. Do you have any nausea, vomiting with this
No,
one?
no, yeah, Mariam, each time if you
Okay.
start the pain, you need to
Yes, yes.
analyze the pain. It
What
is very
causes the
important.
pain? What causes the pain to be aggravated?
Actually, when I eat anything, it is aggravated. When I stop
Okay.
eating, maybe decrease, but I'm
Okay.
worried because of bloody diarrhea. Just
Okay.
ask about pain again.
Does the pain go anywhere else?
And no, it is all over my abdomen. It is generalized abdominal
All
pain.
right. Do you have any? So you see, like from 1 to 10, how bad do you think your pain is?
So you mean that one is low and the 10
One
is
is one
high.
being
So
low,
I think it is about five.
about 5. Okay. Then how about did you have any fever during
No
this
fever.
week? No fever. Any changes in your eye color, skin
No,
color?
no jaundice.
Okay. Any changes in your urine? Do you
No,
notice that there's very less amount of urine than
no.
normal? Okay. So, did you have any loss of weight during this 1 week or
Yes, I
just
found I have loss of weight, but the doctor tell me it is because of this bloody diarrhea. So
mm,
I just lose some protein in my stool.
okay. So, about regarding your bloody diarrhea, is it mixed with stool or does it come with
No,
mucus?
it is like mixed with mucus, not
Mixed with mucus.
yes, it is.
Okay.
It is with mucus.
So, when you say diarrhea daily, how many episodes do you?
No, it can sometimes it is 5 times, sometimes 3 times. So it is
Okay. So,
usually I go to washroom. It is once or twice per day, but nowadays it is more frequent.
is it fresh blood or do you feel like it's like a bit changed?
No, no, no. It is mixed with the stool and the mucus.
Okay. Do you feel like there is any pain after you pass stool?
No, no pain, but I lost some fatigue and easy fatigability because of this of blood loss.
Okay. So
So you
every
need to ask about sign of anemia,
okay.
like easy fatigability and all this. Yes, I have it.
Okay. And usually how much blood, you said more than 5 times daily. Every time you go, is it a large amount of
It is
blood?
not a fresh blood, but it's a mixed. It is like mucus and shedding of epithelial cell, so it is look like bloody diarrhea.
Okay. So do you have any shortness of breath during this,
No,
since this started?
no.
No shortness of breath. Do you
I
feel?
just easy fatigability. That's it.
Okay. All right. Then, do you have any long-term illnesses where you take any medications,
Like what?
like your hypertension, diabetes, uh,
No,
cholesterol medication, or
no.
any abdomen-related issue which you have been diagnosed before and taking
No, but sometimes I found arthritis, joint pain, and the doctor say maybe related to my condition.
medication?
Sometimes also I have some eye troubles, and doctor say maybe related to my condition
So,
because
this
this
bloody
condition is common in my family.
okay, this bloody diarrhea, is it just this 1 week or did you have it before
No,
also?
I have it many times before.
Okay, all right, but you have never like sought medical attention before for
No,
this.
I thought it, but
Okay,
okay.
were you given any medication for this bloody diarrhea?
Sometimes they give me some sort of cortisone enema. Sometimes they give me some tablet.
Okay, did anyone do an endoscopy for you, colonoscopy for you during
Yes,
this
I will show
phase?
you later the picture. The
Okay,
doctor show you the
did
picture.
they take any sample for biopsy or tissue
Yeah,
for biopsy
I do
during this?
everything. I make a complete workup. The
Okay,
examiner will show you later.
all right.
So what's your diagnosis?
So I think this is IBD, irritable bowel, IBS,
Inflammatory bowel
yes,
syndrome.
inflammatory
Okay.
bowel disease.
Why?
Because the presentation of multiple episodes of similar presentation with the history given of the arthritis, iritis, and strong family
So
history.
what this we call it? If the patient have arthritis or something in eye, it is called extra intestinal
Extra
manifestation.
intestinal
Okay.
manifestations of
Sometimes in the history we mention that the patient have related stress or financial problem. Sometimes
Mhm.
it can be precipitated. What is the investigation you ask it to do?
I will do routine blood investigations of full blood count, urea, electrolyte. I
Okay,
mean,
so you mentioned it is inflammatory bowel disease. What's the cause of that?
so inflammatory bowel disease, it could be because of familial. It can
Till
be,
now, I think we don't know.
yes,
Okay, maybe in future. Okay, so you
yes.
ask for colonoscope to done. This is a picture of colonoscope.
Okay.
So
So
what you see in the colonoscope?
I can see crypts and mucosal ulcerations, which is extended long segment mucosal ulcerations with epithelial, I mean mucosal breakage and crypt
Okay,
formation.
all right. So in the histopathology, we find granuloma. So it is
Granuloma.
confirmed which diagnosis. It
Crohn's
is
disease.
Crohn's disease, not ulcerative colitis.
Yes.
Okay. All right. Okay, so this is Crohn's disease, and this is the microscopic picture thickness.
Mhm.
So which layer is affected by Crohn's disease?
Or the throughout.
You mean that all layer?
Yes.
Okay, what's the difference between Crohn's and ulcerative colitis?
So in Crohn's disease, it can be skip lesions with
Okay,
uh,
and about the layer affected, which one is the all layer affected?
whole layer affected in Crohn's disease, but ulcerative colitis, just the uh,
Okay, this is ulcerative
mucosa.
colitis, just the mucosa can be
Mucosa.
pseudopolyp. So which
Yes.
one is liable to have perforation and fistula?
Crohn's disease is more likely to have fistulations and ulcerations with crypt formations.
Okay, thank you.
Thank you, boss.
All right. So back again. So as you see, Crohn's disease is very important. In acute abdomen, we have three scenarios. We have acute pancreatitis, common in England. We have acute cholecystitis or acute cholangitis, common all over the world. And we have Crohn's disease or ulcerative colitis, which is only common in European country. Again, it is important if you don't mention the patient nationality or the which country, so we consider the patient is a British patient. Okay, that is clear. So this is British exam. If we don't mention in any scenario, any script, this patient is Indian patient or what we called it, what other nationality, it means that this patient is British. Of course, in all center, it is difficult to bring the patient look like British, but we consider him as a British. All right. So we have a second scenario is about lower limb pain. So this is what we have in acute abdomen. Again, is acute cholecystitis, acute cholangitis, acute pancreatitis, and Crohn's and ulcerative colitis if have. Of course, they have extraintestinal manifestations, so it's important to ask about arthritis or ankylosing spondylitis or iridocyclitis, common in both Crohn's and ulcerative colitis. Okay, who's next? We just have a scenario of, I think I share or I need to share. I think I will share. Okay. So we have this scenario, and this scenario is about 62 years old man seen in outpatient clinic, complain of pain in the lower limb after walking. Okay, and we ask you about this. Okay, anyone?
Hello?
Hello, yes,
Hello?
can. Hello, yeah, yes, I
Yes.
hear you, Dr. Muhammad. You can start. Okay,
Hello,
good
I'm Dr.
evening.
Good evening. Hello,
Yes,
I'm Dr. Shael, one of the surgical doctor.
yeah,
Can you
yes.
confirm your name, please?
Yeah, I am Mr. John. I'm 65 years old.
Nice to meet you, Mr. John. I will be here with you today.
Okay.
Can you tell me what, how
Yeah.
can I hear you?
Yeah, I have pain in my left leg.
Okay, I'm very sorry for that. I can give you some painkiller if you
Yeah.
want.
No need.
Okay, could you tell me when did this
Yeah.
pain started?
It is just 1 week ago. I was walking. I found severe pain in my lower limb, left side.
Okay, again, I'm very sorry for that. And can you tell
Okay.
me more about that pain?
Doctor, no need to tell much. Sorry, it is not embarrass the examiner or not embarrass the patient.
Okay, and
It is
that
like you make a movies, so it's not a correctable correctable policy. Okay, next
okay.
one.
And did it start suddenly or gradually?
No, it is suddenly I was walking every day. I just walking for about 1 kilo. After this 1 kilo, I found severe pain in left leg.
Okay. And this pain is increasing since the last week or decreasing or come and go?
No, it is. I just need to stop 5 minutes. After I stop, the pain is improved, and after that I walk again, and after that I need to stop again for 5 minutes.
Okay. So you tell me this pain is improved by rest and it is increased by
Yeah, I
doing
need to
any
rest
exercise or
at
walking.
least 5 minutes. Yes.
Okay. Could you please confirm to me how far you can walk until you
One
experience this pain?
kilometer. It is 1 kilometer. So 1 kilometer is about 15 minutes.
Okay. And is there is any rest pain?
What you mean by rest pain? When I was rest at home? No, it is occur
Yes.
only in walking. Yes, it is occur
Okay. And
only in walking.
does this pain affect your daily activity?
What you mean by daily activity? I'm retired, so it's not important for me. I just retired.
Ah, okay, good. And could you please confirm which side of your legs is
It
the
is
pain?
the lower part below the left knee. It is the calf muscle.
Ah, okay. And does this pain moves anywhere else?
No,
Okay. Could you please describe for me the character of the pain? Is stabbing
it
or
is
shooting
like
or
cramping
dull?
pain. It is cramping pain.
Okay. And
Yeah.
does it is associated with any other symptom as like weakness in your leg or numbness or any other symptom?
Just one by one. Weakness, no. Numbness, sometimes I have numbness, but it's not associating with pain.
Okay. And does this pain from in the scale from 1 to 10? How much do you rate your pain?
Yeah, it is about 5.
Okay. And does this pain associated with a specific time through the day?
Associating with what?
A specific time, any specific time, or just when you do
No, it is just
an
a
exercise?
time of walking. This pain occur when
Uh,
I walking only. I walking early in the morning, sometimes in sunset.
okay, thank you. I need to ask you some more question regarding this pain. Is that
Okay,
okay for
can.
you?
Okay, can.
Okay. Do you have do you notice any redness on your leg?
Redness, no, but I have some redness between my toes.
Okay. And okay, I need to ask about. Just give me a second. Okay. Is there any reason to trauma your leg?
No trauma. No trauma.
Do you notice any breach in your leg or feet?
What you mean by bridge? You mean like wound?
Breach, yes, wound.
Wound, yes. Sometimes, yes. I have wound and the healing is not good.
Okay. Do you feel coldness in your leg or feet?
Yes. In comparison to other leg, I feel it is more cold and the more pain in comparison to other leg.
Okay. And is walking uphill or upstairs affect this pain?
No. But if it is
Okay.
if suppose it is affected by pain, what is your diagnosis?
It may be ankylosing spondylitis.
No,
I'm
actually,
sorry,
it is
spinal canal stenosis. Sorry, it
spinal
will be a
canal stenosis.
spinal canal stenosis. Sorry.
Okay, all right. But spinal canal stenosis can come in the orthopedic station, and this is surgical station. Don't worry. Okay, what else?
Okay. Okay. Do you have any difficulty in breathing?
No,
Do you have swollen legs?
no.
Okay. And does this pain is increased when you press on it?
No.
Okay. Just to make sure, so you tell me there is some kind of numbness in your leg and also
Yes,
some wound.
yes, With
and
bad
the
healing,
pain
yes. And the
with
pale
bad
and
healing,
cold.
yes. Yes,
Yes,
pain and
pale and
cold,
cold.
and
Yes.
okay. I just
Okay.
need. Do you have any chronic conditions, medical conditions like
Like what?
diabetes or hypertension?
Diabetes. Diabetes, not hypertension. Yes, I have.
Okay. Do you take any medication for it?
I take Brondopil, which is EC inhibitor.
Okay. You know the dose of it?
It is 5 milligram.
Okay. Besides this, do you take any other medication regularly?
No, the doctor described me something for cholesterol called statin, but I don't take it.
Okay. And do you have any allergy against any medication?
No,
Okay. Did you go through any surgical procedure?
no,
Okay. Does anyone of your family have any similar condition?
no. But my father died from heart attack.
Okay, I'm very sorry for this. Maybe he rest in peace.
All right. Okay. Thank you.
Okay, just I need to. Do you smoke cigarette?
Yeah, I smoked 10 cigarettes per day for the last 50 years.
Okay, what about alcohol? Do you drink?
Yeah, I drink 1 can of alcoholic beer every day.
Okay, I just before we finish, I wanted to ask you some more question regarding your general health. Okay,
Okay.
do you have any tremors or irritability?
No.
Just pain or cough? Experience cough?
Yes.
You have chest pain?
No chest pain.
Okay, irregularity of heartbeats,
No.
diarrhea or constipation,
No.
any missing urine or stool.
No. No.
Okay, do you have any weakness or bone pain?
No bone pain. No.
Okay, I finished my
All right.
questions. Thank you
Thank you,
for your
doctor.
time.
Thank
Okay,
you. Thank you. Just I need to confirm with you. First, you ask about the dose of the antihypertension. So what is important to know the dose?
because I am taking. It is not just important here to specifically to the patient, but if I take history from any patient, I need to know the medication he take and the dose of it.
No, no, it is not
Uh,
necessary because it is according. In medicine, okay, I agree, but here it's not important just to know that he take Barundopil or something. But when I tell you, as a doctor, described to be anti-statin or anti-cholesterol, and I don't take it, what you expected to ask me?
I should ask you about why you didn't take it.
Why you don't take it? Yes, because why you take
Okay,
it maybe have a side effect, something like that. Of course,
okay,
although you take a history good, but from the exam point of view, we don't consider it is good. I tell you why. Because
okay,
after you take a history, you ask all this, no problem. But it is important to ask about history of ischemic symptom. What you expect in this case? What is your diagnosis?
it maybe the chronic
Not
ischemia,
maybe. What's your diagnosis? Chronic
my
ischemia.
provisional
What is
chronic
this?
ischemia.
What is this pain of care? What we called it?
It's claudication pain.
Intermittent claudication pain. So if you examine this patient's skin, what you looking for?
You're looking
So you
for
need
any ulcer.
straightforward, like
Yes.
ulcer. Yes. What
Skin
else? You ask
changes.
about it. Skin change, loss of hair, infection
Okay.
between toes. You ask it, but indirect. So it is important in case of ischemia. You need to start by ischemic symptom, skin manifestation, like loss of hair, like wound or ulcer, like infection between toes. I promise you for that. You need to ask about sensation and the coldness. You ask about this. You can ask about muscle atrophy. You can ask about sensation. You ask about this. No problem.
Okay.
Okay.
Okay. Thank you.
Of course, a systematic review, you take it lightly, but it's okay at the end you finish it. Medical history, chronic history, drug history, family history, history of allergy is taken. Of course, after that, we have a physical examination. What's the investigation you need to do for this patient?
I need to do a blood investigation, cholesterol, and also I need to do an Doppler ultrasound. I need to do
Yes.
blood glucose level and the lipid profile and
So what
ACR.
test, physical test you need to do? Physical test. In physical
Physical test?
examination, what other test you need to do?
Don't know.
Okay, if you elevate the patient leg like this and make it back, what we call it? Like this and make it
So I
down.
don't.
It is burger test. You
Yes,
hear
I
about
am.
burger test and
Yes,
you need
yes,
to measure
yes,
the
yes, yes.
brachial index. Okay? All right.
Okay,
After that,
that's
you have a Doppler. After that, you can have, you ask for angio. So this is the
CT
angio. What's
angio
your
or
diagnosis?
MRA?
What is, say
It
again,
is
angio and? No, angio what?
maybe MRA artery.
What is MRA mean?
It is like CT angiography, but with MRI machine. It is MR.
It is done. It is done in your hospital, or you expect it to be done in your hospital?
It is not done in my hospital.
Okay, if don't done in your hospital, don't tell about it. Okay?
Okay.
So what you see here?
It is ischemia. It is at the
Which
popliteal.
leg? Which leg? Which leg?
It
Right,
is the
left?
left leg. It is left leg.
What you have? Yes.
We have ischemia as
You mean obstruction?
obstruction.
Ischemia
Yes.
is obstruction in the end of which artery and the beginning of which artery?
In the end of femoral artery and the beginning of popliteal artery.
So what you will do for this patient? What you will do?
It is a surgical option. It will be stent or
No. Just relax one by one. So you make an angio. You need to remove the thrombus. You have a stricture. So how to make with this stricture? What you will do?
maybe a balloon dilatation and
Balloon
also-
dilatation. If it does not succeed, you put a stent. Okay.
Okay.
All right. So it is important to know that. Again, don't say investigation complicated or expensive. We don't use this. What other investigation or physical examination you will ask for? Ankle brachial systolic index, Berger test, handhold Doppler. By the way, handhold Doppler is mandatory in exam. In vascular case, we have handhold Doppler, so you need to know how to use the handhold Doppler. Is very, very, very important. Okay.
Okay.
Of course, you need to be more systematic, Dr. Muhammad. I think it's better to be more systematic. You concentrate on the diagnosis. You can concentrate on skin manifestation first. You take it at the end, but it takes time from you, but take at the end. Okay. The last for today, I hope that not cut with it, is bleeding upper rectum. Can come bleeding upper rectum, can come interbowel habit, can come something like that. And usually it is common scenario. The last exam in Malaysia just 2 days ago, we have this scenario. It is 62 years old Chinese man attended outpatient, complained from interbowel habit. By the way, cancer colon or others is common in Chinese also, not necessary to be European. So we just start by this scenario. Any volunteer? Thank you, Dr. Muhammad Ashaib. Anyone?
Okay. I can do it if there is any...
Okay, you can do it. All right. So I am Mr. Limp, and I am 65 years old.
Okay, nice to meet you, Mr. Lim. I will be here with you today. How can I help you?
Okay, I just have interbowel habit. Sometimes 1 week, last week I have constipation, the last month I have diarrhea.
Okay, and it is the first time you experience this?
Yes, in the last 2 months I have this is alternation of sometimes constipation, sometimes diarrhea. I mean by constipation because my normal habit, I went to the washroom or it is once per day. But sometimes I found I need to go to once per every 2 days. And when I have a diarrhea episode, I need to go to 5 times per day.
Okay, so you have now you come here complaining of diarrhea or constipation now, the recent one,
It is not
the most
important
recent
for
one.
you, but it is now it is constipation. But it is not
Okay,
make a
and
difference. Okay.
okay, and this symptoms is increasing or decreasing?
Not it's stationary. It is just 2 months or 1 month ago.
Okay,
So it
and
is just annoying
does
me.
okay, does anything make it better? You take any medications that make it better
No,
or
actually,
any
actually,
can?
actually, yes. I just no. I go to the doctor, and the doctor say it is serious condition, and you need to do further investigation.
Okay, and you did any investigation or not?
Yes, I did it. The examiner show you the colonoscope picture and others.
Okay, so you have diarrhea?
You have alternative diarrhea and constipation. Forget this
Okay,
topic. Ask about other
is there
colonic
is
symptoms.
okay, there is any blood diarrhea or?
Yes, I have a bleeding per rectum. It is painless blood per rectum. Yes, I have.
Okay, could you describe to me the color of the stool, of the blood?
It is dark color stool and mixed with blood mixed with the stool.
Okay, and could you tell me the amount of the blood?
Uh, it is I don't know because it's mixed with the stool.
Okay, if there is any mucus in the blood
Sometimes.
and any streaks?
Any what?
Streaks as clots in the.
No.
Okay, and do you have any abdominal pain?
No.
Okay, so you tell me it is bilious blood, that's right?
It is painless bleeding per rectum or blood mixed with the stool. Yes.
Okay, did you experience unintentional weight loss recently?
Yes, I lost 5 kilos in the last 1 month.
Okay, and any change in your appetite?
No.
Okay, do you notice any anal swelling?
What you mean by anal swelling?
Any swelling in your back
You mean
passage?
hemorrhoid, something like that?
Yes.
No.
Okay, and
If you need to ask something related to anus, it's better to ask about fecal incontinence because can indicate the tumor in the anus, or you ask about tenesmus, which is incomplete evacuation. Okay?
okay,
What else
okay,
you need to ask?
okay. Is there any bleeding from any other side?
Bleeding tendency, no.
Okay, do you have experience travel recently?
What you mean travel? I live in China, so I travel to Malaysia.
Okay,
What
do
you
you
ask
have,
about traveling?
because it maybe has a severe gastroenteritis, maybe the cause of it, maybe severe
Okay,
gastroenteritis with.
don't be so clever in exam. What you
My,
expected this case? What you expected this case?
I expect this case due to bleeding in the rectum and the unintentional
What you
weight loss,
expected? What is your
can,
diagnosis?
cancer colon.
Cancer colon. So in the cancer colon, you need to ask about what we call it colonic symptom. This colonic symptom is like irritable bowel habit, bilious bleeding of the rectum, fecal incontinence, tenesmus. And after that, you ask about loss of weight, loss of appetite. You need to ask about family history of cancer. You need to ask about social history like smoking and alcohol. Okay?
Okay, okay.
But you need to ask about fever. Why you ask about fever?
It is to exclude maybe diverticulitis or also
Okay, so it is,
gastroenteritis.
forget doctor. We are in British exam. In England, no one have gastroenteritis. He need to travel to India to have gastroenteritis. Okay?
So it's
Don't be too clever in
okay,
exam. Yes?
okay, okay,
Even if your exam in India, it is a British exam. Okay. Except
okay.
I mentioned you, this is Indian lady, or this is American or British travel to India. Okay. The scenario, the script of all
So
station
it
in
is. It was
exam.
a Chinese patient.
No, we make it
It was
Chinese
a Chinese
because
patient.
in Chinese is the cancer colon is common in China, because in the Southeast Asia,
Okay.
especially in Malaysia, we have Chinese people like called Chinese Malay. Okay, don't worry.
Okay.
All
Okay.
right. Okay. So I just review with you again. So you need to ask about fecal amount of blood. You ask about painful defecation or painless defecation, alter bowel habit, tenesmus, fecal incontinence, loss of weight, loss of appetite. You must ask about fever, toxicity, diverticulitis. After that, you ask about medical history of chronic disease, drug, family, social allergic. After that, other system. Okay, what's your differential diagnosis is cancer colon. What other differential diagnosis if the patient have loss of weight, no loss of weight, can be diverticulosis or some rare. What is the rare condition in 70 years in England can cause bleeding of the rectum and is not a cancer?
Bleeding rectum, but not a cancer.
Not a cancer in 75 years old. Not a cancer. Not common in your country if you are from Egypt.
I don't know.
It is something called angiodysplasia.
Yes, angiodysplasia. Yes.
Yeah, so we have other differential diagnoses like colorectal cancer, we have angiodysplasia, we have diverticulitis. Diverticulitis easy to differentiate it by fever, by tender abdominal. So this is why Dr. Muhammad asked me to ask you about abdominal pain. If patient have
Okay.
painless bleeding per rectum, no abdominal pain, so it is not diverticulitis. If have abdominal pain, especially left iliac fossa, fever, so most probably it is diverticulitis. I think maybe suddenly we stop. After that, this is the investigation. What is the tumor marker? We can use it for cancer colon.
CA19.
No, CA 19 mean 19. It is for
Yes.
cancer pancreas.
So it CA and
CAA, carcinogenic embryonic antigen, is the tumor marker for cancer colon. Okay,
okay.
I think maybe suddenly disconnected, but just can you stages how to stage cancer colon? What name of stages you know for cancer colon?
Stage of cancer colon.
Like Dioxys staging
Yes,
and
Doxa
TNM
staging
staging.
is yes.
Okay, so this is Diox, A, B, C, D. So
Yes.
A, superficial, B, whole thickness, C, come to the lymph node, D, to other organ.
Okay.
Okay, so why important we know this staging? Why we have this staging?
Because it for treatment and for
No, not for
prognosis.
treatment. Staging is not for treatment, it is for prognosis. Because
Prognosis.
usually you know the staging after surgery, so it is means that first stage or stage A is good prognosis. What you mean by good prognosis?
A good prognosis is the 5-year survival rate after
It's very
it
high.
is
Yes.
very high.
It is like you can see here in stage A, 90% 5-year survival, in D, 15. If the tumor about TNM staging, if the tumor invading nearby organ like uterus in female, what we call the T what?
It will be T4.
T4. Okay, so T4 mean invading. If you go to TNM staging, you can find T4, which is invading nearby organ. T3 penetrating muscularis propria. TNM staging for cancer colon is very important. T for tumor, N for lymph node, M for metastasis. Okay, and this is the picture if we need to show you cancer. So this is a picture indicate what? What is this picture? It is not a cancer. What is this?
It is FAB. It's familial adenomatous polyp,
No,
I
it is
think.
not a polyp. It is something like this.
Diverticulosis.
This is diverticulosis. This is diverticulosis. This diverticulosis, and this is familial adenomatous polyposis. And this is
Okay,
just
could you-
single polyp.
Okay.
Yes, you see it. This is a lotus root. It is Egyptian plant, but you don't see in Egypt. It's lotus. It
Yes,
is
I
a
know
lotus
lotus.
root. Yeah, this is a lotus
Okay.
root. It look like diverticulosis. It is a common ancient Egyptian plant. In Asian countries, they eat it. In Egypt, they don't eat it. Okay. Next
Okay.
time, I also start again in these topics because cancer colon is very, 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 very important. and we can see, because the call is about to end. I think if you just Google